Hi, everyone. It's great to see all you wonderful women here today to join me on this Sunday afternoon. My name is Erica Brome, and I'm a sophomore at Purdue University Northwest in Hammond, Indiana. I am so excited to be able to present to you all today and share some of the knowledge that I have gained about my topic I have been researching, which is PCOS. I chose this topic because I have a few family members and close friends who have been diagnosed with this condition, and I was intrigued and passionate to learn more about it. And I hope you are all too, since you are all here at this PCOS presentation. So to give you all kind of an outline on where I would like to take this presentation, I will first explain to you what PCOS is and who can get it. Then I will discuss the causes of this condition, its symptoms, how it's diagnosed, what complications may come along with it, and how it is treated and managed. I hope all you beautiful women enjoy this presentation. I hope you learned something new. If you have questions, feel free to jot them down, and I'll answer any of them at the end of this presentation. So to start off, what is PCOS? I would like to give you all a background on what PCOS is. I have a feeling that most of you probably know a little bit about it since you decided to join me today. Some of you may even have the condition. But maybe for some of the people who aren't as educated, PCOS, or polycystic ovarian syndrome, is an incurable condition found in females that is characterized by the ovaries producing an abnormal amount of androgens that in turn suppress the woman's natural menstrual cycle and ovulation. Androgens, for those of you who don't know, are male sex hormones. The most notable, and the one you've probably heard the most about, testosterone. The name polycystic ovarian syndrome is derived from the cysts that are typically found on the ovaries of a woman who has PCOS. Now, I say typically, but a woman does not need to have cysts on her ovaries to be diagnosed with this condition, because some women just simply don't get them with PCOS, and that's just common. So here I have an ultrasound of a normal ovary and a polycystic ovary. The ovary on the left is the normal one, and as you can see, it's not laden with any cysts as the one on the right is. Most of those black dots that you see on the polycystic ovary on the right are the cysts. Here's another graphic. You can see the polycystic ovary labeled there, and you can see the grayish colored cysts on the ovary, and you can see that it looks a little bit enlarged and inflamed compared to the healthy ovary on the right. So who can get PCOS? PCOS is actually much more common than you might think. In fact, about 10% of women of childbearing age have PCOS. A woman can be diagnosed with PCOS at any time after puberty, but the most common ages to be diagnosed with it is between the ages of 20 and 30. This is because between the ages of 20 and 30, most women are trying to become pregnant, and when they're struggling to become pregnant, they'll go to their doctor or their fertility expert, and they'll try to figure out the reason why they're having trouble. And a lot of times this is when they find out they have PCOS. A lot of PCOS symptoms are symptoms of other conditions, so a lot of women don't even realize that they have PCOS, or they may be asymptomatic in total. In addition to this, a woman is more likely to be diagnosed with PCOS if she has a family member with it. So that shows that genetics do play a role in this condition. A woman is also more is also more likely to get PCOS if she is considered overweight or obese. And as you'll learn later, quite a high percentage of women with PCOS are overweight or obese. So what causes PCOS? The main cause of PCOS is high levels of the male hormones called androgens. The question is, what causes a woman's hormones to shift so that her androgen levels are too high? One of the main causes of this is a diet high in refined carbs and sugar. This is a cause because these foods cause insulin levels to be too high, or they can even cause insulin resistance. Insulin resistance, for those of you who may not be too familiar with the term, occurs when the cells in one's body do not respond to insulin, and they therefore have trouble taking up glucose from his or her blood. Blood glucose levels are in turn high because the pancreas has to make even more insulin to help in the uptake of glucose. Interestingly enough, high levels of insulin actually cause the ovaries to release androgens. This just kind of shows that everything in the body really is connected, and that everything in the body is connected. So androgen and hormone levels are affected by diet, and this can cause the woman to not ovulate. Another factor that can cause insulin resistance, besides just a diet high in refined carbs and sugar, is being overweight or having obesity. In fact, 80% of women diagnosed with PCOS are considered overweight or have obesity. One might question, how does being overweight or having obesity cause insulin resistance by itself? The answer lies in the fact that obese individuals carry a lot of extra adipose tissue, or in simple terms, fat. Adipose tissue does much more harm to the body than just add extra weight. Adipose tissue actually releases high amounts of chemicals that are involved with developing insulin resistance. Some of these chemicals include certain hormones, cytokines, which are chemicals that induce inflammation in the body. And there's a ton of other chemicals that are released by adipose tissue. But this is a very scientific topic for another time. So here I have a graphic. The three graphs are three different types of androgens. Androgens, while they are a male hormone, they also are found in females, just in way smaller amounts than you find in males. The main one I want to focus on here is testosterone, because it is the most widely known hormone. You can see on the blue bar, that would be a normal woman in her day 2 to 4 of her menstrual cycle. You can see that her testosterone levels are just above 300, probably around 325. And then you can see in the red, that is a woman with PCOS. Her levels are much higher, almost to the 500. And so that definitely is concerning, and it is a characteristic of PCOS. So what are some of the symptoms of PCOS? How would you know if you have it? One of the most telltale signs of PCOS is irregular periods. Irregular periods can show up as missed periods or very light periods, or sometimes even really heavy periods, but most of the time they're going to be your missed periods. Another one of the most telltale signs is cysts on the ovaries, but as I did mention before, not all women diagnosed with PCOS get the cyst on their ovaries. Some other symptoms include hirsutism, which is excess body hair, which is usually found on the back, the chest, along the jaw, along the neck. Some other symptoms include weight gain, especially around the stomach area, acne and oily skin from the hormonal imbalance and androgens, thinning hair, male pattern baldness, skin tags, which are just like little pieces of extra skin that tend to grow up a little bit like a wart, but not considered a wart, and dark or thick skin patches on the neck, armpits, or under the breasts. And these are all symptoms of PCOS. So here I just have some pictures of it to help you guys maybe be able to visualize what these symptoms are. You can see in the top left, we have the cystic ovaries. As I've mentioned, not every single woman will get the cysts. We have the acne and oily skin. We have the skin tags in the top right, the excess body hair. In the bottom middle, we have the male pattern baldness or the thinning hair. And then in the bottom right, we have the dark, thick skin patches, and those are normally found in the neck and the armpits. So how is PCOS diagnosed? There are several ways in which a woman may be diagnosed with PCOS. The most common will be a pelvic exam that checks the health of her reproductive organs, both inside and outside the body. The doctor may also order an ultrasound to look for the cysts on the ovaries. If you can remember back to the picture I had of the normal ovary and the polycystic ovary, that was an ultrasound, and that's how they'll tell if you have cysts. And that may diagnose PCOS if you are one of those people with a cyst. Moreover, the doctor may order blood tests to look at your androgen levels or your blood glucose levels, because these are often telltale signs of PCOS if they are high. The doctor may also look at your cholesterol and triglyceride levels to kind of check what the quality of your diet is, how your inflammation is doing, because those do play a role into PCOS as well. So what complications can PCOS cause? I'm not going to delve too far into this because it is quite a broad topic, but there are many complications that can arise. Some of the serious health problems that can be caused by PCOS or made worse are type 2 diabetes, high blood pressure, heart and blood vessel problems, uterine cancer, and probably one of the most prevalent with PCOS is infertility because of the either lack of ovulation, the inconsistency of ovulation, and that can just really cause problems for the woman to get pregnant. So how is PCOS treated? PCOS may be treated in many different ways, but the type of treatment really depends on a couple different factors. These factors include the woman's age, how severe her symptoms are, her overall quality of health at the time that PCOS is diagnosed, and whether or not she wants to become pregnant. For this sake, I'm just going to cover the kinds of treatments that will be given for a woman who wants to become pregnant or a woman who does not want to become pregnant. So if the woman wants to become pregnant, then her treatment for PCOS would include a big change in her diet. This could help her lose weight. Obviously, diet plays a big role, so does activity, but diet is usually a very big factor in weight. Losing weight may help her body lower its blood glucose levels, in addition to using insulin in a more efficient manner, and in turn may help her body ovulate. In addition, in a change in diet, the doctor may prescribe a medication that is capable of helping a female patient with PCOS ovulate. This medication has its risks and benefits, though. The risks include the fact that it can increase the chances for a multiple birth. So you could have twins or triplets while taking this medication. And it can also cause ovarian hyperstimulation, which is when the ovaries release way too many hormones than what they're used to. Obviously, one of the benefits would be that you are ovulating and you could get pregnant. But if you're going to go on this medication, you do need to be careful. If the woman does not want to become pregnant, her treatment may include birth control that will help balance her hormones, control her menstrual cycles, and ultimately lower her androgen levels, which is the prime driver of PCOS. I would say that birth control pills are probably the most widely used treatment for women who do not want to become pregnant. But the woman may also be prescribed medication that is commonly used for diabetes, which will help improve insulin resistance and blood sugar levels, which, as we've covered several times, this will help reduce androgen levels and hopefully start to lessen the symptoms of PCOS. And finally, similar to women who do want to get pregnant, a change in diet is also imperative as well. You can't just continue to mask the symptoms without really changing what's causing the condition in the first place. So I would like to really focus on how a change in diet can help treat PCOS, because I have mentioned this several times. So it's imperative that you all understand that the main cause of PCOS really is diet. Okay, it really is diet. A poor diet can cause both very improper blood sugar levels, it can cause insulin resistance, and we know it can cause obesity. And so a diet high in refined carbs and sugar is mainly what will cause those insulin problems. Examples of refined carbs would include white bread, pasta that is not considered whole grain, muffins, breakfast pastries, most desserts that you'll find, and really anything made with white flour. White flour is stripped of all the nutrients. It's stripped of the fiber, which, as I'm going to discuss in a little bit, fiber is very important to controlling your blood sugar levels. In addition to the refined grains, sugar is a huge contributor to insulin resistance, probably even more than refined carbs. Sugar is found in so many food products along the market. You really have to be careful about the foods you're selecting because chances are sugar in one of its many forms will be found in it. And sugar has a plethora of names like dextrose, high fructose corn syrup, sucrose, and it's honestly, there's dozens and dozens of more names to just hide the fact that there is sugar in many of these processed foods. So the topic of sugar and its many negative health effects on every single part of the body is a completely different topic for another time. So I'm not going to delve super far into it. I just need you all to know that refined carbs and sugar really are a huge driver for PCOS because of the impact it has on blood sugar and insulin and ultimately androgens. Other foods that should be avoided include lots of fried and like unhealthy fatty foods like pizza. And margarine's a huge one because it's made of just really crappy oils. Butter's almost a better way to go rather than margarine. And the reason why is that these fried foods and margarines are laden with very inflammatory fats, not many omega-3s at all. And omega-3s are super important to lowering inflammation. And women with PCOS generally do have chronic inflammation, and this helps to drive the disease, just as inflammation drives most other diseases. So I've been sitting here talking a ton about the foods that you should avoid. So I think it's time that we talk about the foods you should love as someone who maybe wants to prevent PCOS or someone who has PCOS and wants to make your symptoms better and become pregnant, things like that. So you should choose the foods that are high in fiber and reduce inflammation. So to emphasize that, high in fiber and reduce inflammation. High fiber foods help to combat insulin resistance due to the fact that they slow the impact that the sugar has on the blood. So for example, say you're eating a cookie and there's no fiber. The digestion is not slowed down by the fiber, so the sugar goes immediately into your bloodstream, as was compared to, say, an apple. An apple does have a fair amount of sugar, generally around 15 grams of sugar, but there's also a lot of fiber in apples, and that fiber helps to really slow down the digestion of sugar, not to mention the type of sugar in an apple is a little bit different than the type of sugar that you would find in, say, a cookie, but that's just an example. So yeah, as I said, high fiber foods are important. Some high fiber foods would include cruciferous vegetables like broccoli, kale, chard. Some other high fiber foods include greens like kale and spinach, anything along those lines. Bell peppers, beans, and lentils are really high in fiber. They're also really high in protein, which protein is really important for balancing your blood sugar levels and just for health in general. So yeah, beans, lentils, almonds, berries are great. Sweet potatoes, winter squash, and pumpkin, those are all foods to love. Foods that reduce inflammation are extremely important as well. There's way more foods than that reduce inflammation than what I'm just going to mention here. But some of the better ones include tomatoes, kale, spinach, almonds, walnuts, olive oil is great, blueberries, super high in antioxidants, strawberries, and fatty fish like salmon, mackerel, tuna, sardines, things like that. But really, when you take a look at the types of foods that are on the screen ahead of you, and if I back up one slide, you take a look at these foods, the main thing you're going to notice is that these foods have one ingredient in their ingredient list. They don't even have an ingredient list because all it is that specific food because it's derived from its natural source. Whereas these are a mixture of so many different concoctions and refined products that are just not good for your health. And it doesn't matter if you have PCOS or not, they're just not good for your health. So you definitely want to reach for these foods that are going to really cultivate good health, strength into your future, help you ovulate, control your menstrual cycles. Especially as a woman, our bodies are constantly changing throughout the month with our hormones. So you want to be sure that you're balancing those and really making your body a healthy place. So to wrap up, we covered what polycystic ovarian syndrome is. We covered who can get PCOS, its different causes, what the symptoms are, how it's usually diagnosed, the complications that may come along with it, and how PCOS is treated. And I really want you guys, like my take home point here, the treatment for PCOS and how to avoid even getting it. It's going to be your diet. You have to reach for the non-processed foods, the fruits, the vegetables, the healthy fats, the lean proteins like chicken and lean ground beef and all the fish. You're going to want to reach for that stuff because that's what's going to cultivate your health. So I really want to thank all you beautiful women for coming out here today. I really appreciate you listening to me, taking in what I have to say. I hope you learned something from this. And if you do have PCOS, I hope you can take something from this and maybe incorporate it into your own life or talk to your doctor about it, because these things could really help you become pregnant if you want to become pregnant, and maybe reduce some of those symptoms that you're having. So once again, thank you. If you have any questions, I am more than happy to answer them. If you would like to just call me or email me, I'll be giving away my card when this presentation is over. But yes, thank you. Here are my references if anyone is interested in that. But have a wonderful day. Thank you.